I'm a visually impaired woman living with HIV and AIDS. I'm not afraid of saying I'm positive. I'm a diabetic case. I was not born blind, but I lost my sight at the age of 7 when I had an accident with my grandfather's cow. I was playing with the calf, and the cow was so furious with me. It hit me at the forehead with its horn, threw me over the mango tree, and I stuck between the branches. And from that time is when my sight started bringing problems.
A Global Fund Round 7 is mandated to implement the civil society component of the program, basically dealing with the HIV and its programming within the care health sector. The services we provide with this program, we don't implement directly. We work through partners, and our role is to work towards achieving 3 objectives of the program. And one of the objectives is increasing access to HCT services. Secondly, we are also working towards increasing uptake of treatment and care services. And finally, we have the third objective of building the capacity of CSOs to be better placed to provide these services, since they're the ones implementing direct on the ground.
Disability mainstreaming regards reaching people with a disability as far as HIV/AIDS is concerned. We know that people with a disability face many challenges as compared to the general population in terms of policies, economic empowerment, health, and social adjustment.
I was married to a man known as Christopher Moyonga, and Christopher Moyonga fell sick back in 1986. He had a stroke on the left side. At the same time, he developed kidney problems. He also developed goiter, the combination of those all diseases. We stayed with him until 1996. August 15 is when he passed away. By this time, I knew nothing, and I could not even suspect anything, and I could not even associate him with the HIV and AIDS. Being blind and being a person who you trust your husband so much, I did not even mind where he was sick. I just knew my husband is sick, and that's all. So when he died, that's 96. 97, Catherine was okay. 98, 99, I started now having malaria, typhoid, off and down, off and down. I asked my sons to take me to Kenyatta Hospital.
In the area of HIV and AIDS and health in general, women bear the greatest burden. And when we talk about you and me bearing a burden, then people with disabilities suffer a double burden. We know already people, for example, if somebody has a mental disability and she is a woman, even if another person is sick within the household, it is their role still, they are mentally handicapped, but if it's mild, they still always, oftentimes, take the burden of taking care of the others within the household that are sick.
We have a case, a girl who was 13 years, was sexually abused by a man. She was being bought a soda at just a nearby kiosk, and the man took advantage and took that girl to a lodging. and sexually abused that girl. And she got missing for around 3 hours, which was 6 from. Then they found the girl at around 10, and she was confused. She did not know where she was going.
There are other social factors that hinder people with disability from accessing health services. As a result, these factors contribute to the infection and spread of HIV and poor health conditions. These factors include poverty, lack of education, lack of information and resources to ensure safer sex, elevated risk for violence and rape, and lack of legal protection in specific relation to risk.
Normal people, normally they thought people with disability are not active. So if they heard that somebody has na ugonjwa, anasema mlemavu, anafikiri huyo sio mwanadamu ambaye anaweza kuwa na partner yake. So that one made them to leave us for some time without even kufanya test kwa ulemavu ili wajue ni nani ana ama nani anayo.
My work is to make sure that the Persons with Disability Act, number 14 of 2003, is effected to the letter and the spirit, so that the people living with disabilities in Kenya can be able to realize their full potential and rights as provided for under the law. That is the Constitution as per Article 54(7), and also Article 2 of the Constitution and the United Nations Convention on the Rights of Persons with Disability.
Individuals with disability are at significant risk of becoming HIV infected. A lot of factors are responsible to the spread of HIV among persons with disabilities. As a result, disabled persons have found themselves engaging in risky behavior that makes them vulnerable to STI and HIV infections.
Physically challenged people hawana nguvu sana. So it can mean somebody can rape them. Again, jambo ambayo tunaona hapo pia, unajua vile tunatembea, pengine watu hawatukaribishi sana. Lakini kama pengine umeingia mahali na mtu anaona hii ndio chance yangu, huyu hawezi kuenda mahali, sasa ameingia kwangu. So we can be at that stage, tunaweza kuwa na shida.
We see that persons with disabilities end up in drugs. Why? It is because of a way to fight back the society. They think that if they take a lot of drugs, then they forget about their problems and their situations that are in.
Nitiere kata nyiri moko ma walemavu ma bende wuok ni dhi timo parking. Taparo ni parking no for them mondo mi dhi tam ng'ato kucho no tigi kondom kuomi to ng'eyo ni yuar wi ko nyalo fosi. Aneno ni mano gima ok onego ber ka wadonje.
Perhaps we find ourselves indulging in bad habits or risky behavior due to the situations we find ourselves in. We must take note that succumbing to such pressures put us at a high risk of being infected with HIV. Therefore, we must find ways to steer away from such behavior.
Sisi kama walemavu, chenye wanaonelea tusiingilie sana ni ulevi. Sababu vitu kaa hizo sioni kama inafurahisha na mtu mlemavu. Pengine amekuwa mlevi kiasi cha kupindukia, ameanguka huko na hizo tricycle zake. Pengine we ni msichana. Sasa watu wanapata njia nzuri ya kutumia kwa mahitaji yao. Sasa ndio nilikuwa naona kuna bit zingine sisi walemavu hatufai tuingilie. Vile
nimesikia, people have friends, but that one we don't have here. But we are trying to maintain ourselves. If you are married, we maintain that. If not married and searching, we want you to search in the right way. Not trying here. Later on, you become a victim.
Despite challenges mentioned earlier on, people with disability can still stay healthy by having access to healthcare. The existence of associations and bodies such as National Council for the Disabled partners with other organizations for people with disability to eliminate such barriers.
We have about 5 CSOs that are implementing the program for people with disabilities. And this is in recognition of people with disabilities as a hard-to-reach population. They are people who are otherwise described as marginalized, and therefore we had to work with partners who have the technical capacity and the wherewithal to reach these people. It's easier to reach a person with disability through a person also living with disability. Now, some of the organizations in the program are Kenya Society for the Mentally Handicapped, dealing with the mental disability. Then we have Kenya Union of the Blind, who are specialized in dealing with visual impairment and blindness. And then we have organization for helping hearing impaired people, otherwise described as hard of hearing. And then, of course, we are also dealing with the greatest disability in Kenya, we know, is physical disability. And therefore, we are working with the Kenya Union for empowering physically disabled people.
Mimi ni Community Health Committee, CHC. Nilichaguliwa kama yule ambaye ana represent wale ambao wako na ulemavu. Na vile tulichaguliwa, tulijifunza ama tulifundishwa vile tunaweza kuwa na afya mzuri kwa community yetu, zaidi juu ya wale ambao wako na ulemavu. Maji aiwe safi. Na pale unahisi pia haikuwi na takataka. Na mara nyingi tunafanya pamoja na watu wa CHW, Community Health Workers, ambaye pia tunaangalia kazi yao vile wanaendelea kuhudumia wananchi pamoja na walemavu, ili wamama wengine wasiweke wengine ndani, ama watoto wasikunywe maji ambayo hayajatibiwa, ama pengine sehemu anakaa haikuwe na outbreaks zingine na hawaja report that matter to the government ili action ichukuliwe.
We are trying to enlarge or to expand our service provision, because normally we are an outpatient facility. Health center is maybe an outpatient facility. So we expect everybody to comfortably walk in and access everywhere we want them to go. But we are also trying to put in place like clinic for maybe psychiatric clinic in places where they were not, so that if we do a psychiatric clinic, we are able to capture those ones with maybe mental disabilities. And we are also having clinics that added to on top of our medical, surgical, and pediatric clinics, so that we're able to take care of the other patients who are not comfortable coming to that other clinic where very able persons are. So we are putting up the number of clinics so that we're able to take care of them. And we're also having support groups, because it is easy for one to identify with another person who has a similar problem. So we're putting up support groups for youth, let's say, so that all the youth come together and talk about their issues. We also have a clinic for the physically impaired, so that when I come, the next person also has a disability like me and I'm comfortable. So we are also doing that in our facility so that we're able to bring them on board to access service.
Steps to living a healthy life begins with one having the right information on matters of health, which include prevention on HIV and STI infections.
Ya maneno ya ukimwi nakuja kama unafanya sex na mwenzako, kama ujui vile iko, kama unataka mwenzako, kama unaona huyu msichana ni mzuri kwako, ama the man is so good for you, unaweza ongea na yeye, alafu saa ile unaweza enda na yeye kwa kitanda, unaweza tumia condom.
The best way to prevent yourself from this is abstinence. You stay away from sex. Another way you can contract it when you share things like syringes. A parent can pass it from mother to child, things like that. Pia katika kikundi chetu watu wamehimizwa kwenda kwa VCT, hata wamekuja hapa kufanya hiyo, kwa sababu hiyo hata wengine wamejigundua ya kwamba wana hii ugonjwa. Sasa wamefundishwa, wanajua vile wanaweza kuishi na ugonjwa huo.
One is advised to stay informed by joining groups that receive teaching and training on health issues including HIV and STIs.
Ni vizuri kama mlemavu kujiunga na vikundi ya walemavu, sababu hiyo vikundi kwanza itakufanya usiwe unaona uko lonely ama umetengwa, inakupea moyo, unaona kumbe kuna wengine kama mimi, na inakupea moyo, unapata kujua mengi.
Leading a long and healthy life means adopting certain practices that will go a long way in improving one's physical health and avoiding other health issues. These practices include: try and exercise at all times by finding something to do either at home or in a group.
I decided now to live like a positive woman, taking my drugs on time, attending to the hospital anytime I have a problem, using the necessary balanced diet food, fruits, veggies, especially the traditional vegetables, and eating always what is important for my body. So from when I started now taking care of myself, I knew even how to use, sometimes when my CD4 is low, I have to look for boosters to put back my CD4 where it was.
Get regular checkups. Don't smoke or use illegal drugs. Use medicines wisely. Stay in touch with family and friends. If you need help, talk with your healthcare professional. Everyone, including persons with disabilities, has responsibility to their own health. Taking measures to prevent infection and spread of HIV and STI infections therefore becomes necessary. Measures include ensuring correct use of condoms, seeking HIV testing and counseling services to know your HIV status, joining clubs in your area for psychosocial support, knowing your body, how you feel when you're well and when you're not, talking openly with your healthcare professional about your concerns. When you visit a healthcare provider, take your health records with you. Get it in writing. Write down or have someone write down for you what is said by the healthcare professional. Ask for help in finding more information through materials like brochures or at specific web pages on the internet.
One of the key challenges and one of the greatest needs for people with disabilities is resources. We need more programs for them, but we need more resources because unless we do that, then this is a population that will remain forgotten. Perhaps one other thing to mention is we have a challenge with statistics. For people with disabilities, even the census, the different censuses that have been done do not give you data that is precise enough for programming. We were looking at people with disabilities, for example. Kenya Society for the Handicapped, who are working with people with disabilities, mental disabilities, were unable to get proper data for planning for this program. So it tells you that we require even more resources to do action research to get the right statistics before we even talk about programming. And therefore, I think through this program, we are getting a lot of appeals for people, programming with these people, that they require more resources. But who will provide those resources? It's the high time our government thought about putting in more resources into this. But I believe that's the direction, starting with the new constitution, talking about devolution. I believe we ended there.